You may have seen the Frontline Health Workers Coalition tweet, Health Workers Count. But why is this message so important to us and our coalition of dedicated advocates? We tweet, Health Workers Count, because we recognize how integral health workers have been to advancing global health goals. Health workers have been at the forefront of advancing the 3 Millenium Development Goals on health. MDG 4, reducing child mortality. MDG 5, improving maternal health. And MDG 6, combating infectious diseases. Nurses, community health workers, midwives, physicians, and a range of other health workers in developing countries have been at the front lines of upholding these goals and providing life-saving care to millions of people around the world. Let's start with how health workers have driven progress in ending child mortality. Take this example. In a remote village in Indonesia, Surafina, a young pregnant mother, suspected something was wrong during her labor. Surafina's midwife, trained under a USAID-supported program, safely delivered the baby despite complications with the baby's umbilical cord. In addition to skilled birth attendants, frontline health workers provide a tremendous amount of support through the management of premature births, neonatal resuscitation, treatment of neonatal infections, and so much more. Health workers count because they provide mothers, families, and whole communities with the services needed to save babies' lives.
But it doesn't stop there. Health workers have also been integral in improving maternal health around the world. They can help meet the needs of women before, during, and after childbirth, making them essential to the continuum of maternal care. During pregnancy, they encourage HIV testing, administer micronutrients, and deliver prenatal care and screen for high-risk pregnancies. For childbirth, frontline health workers provide discreet sexual and reproductive health education and distribute family planning services. In the postnatal period, health workers are there to provide immediate postpartum care, which includes breastfeeding support and helping manage and referring any obstetric and newborn complications. Those are only a few of the services health workers provide to mothers all around the world. So why do health workers matter to us? Health workers count because they support, educate, and provide life-saving care to mothers. Last but not least, frontline health workers have been at the forefront of global efforts to fight HIV/AIDS, malaria, and other infectious diseases. Frontline health workers are providing life-saving antiretroviral treatment care and support to millions living with HIV, as well as administering HIV testing and counseling, educating communities about the virus to prevent new infections. Frontline health workers' fight against HIV takes place in both local health clinics and out in the communities, helping patients stay adherent to their medication, providing home-based care, and championing prevention efforts.
So again, why do health workers matter to us? Health workers count because they are on the front lines of fighting HIV/AIDS, malaria, and other infectious diseases.
Despite driving progress in the MDG's global health achievements, challenges still remain for the global health workforce. People in low-income and remote communities are the least likely to have access to trained and supported health workers. The World Health Organization estimates about 1 billion people around the world have little to no access to health workers. To accelerate progress, we must increase our support for frontline health workers. We must address the enormous shortage in the global health workforce to ensure all peoples have access to their essential services.
As we saw, health workers have been integral to the MDG's 3 health goals: reducing child mortality, improving maternal health, and combating infectious diseases. As UN member states consider the post-2015 Sustainable Development Goals, they must prioritize health workforce strengthening and address global health workforce shortages and inequities if we are to make transformational and sustainable change to save lives and enable prosperity. Because isn't it obvious? Health workers count for babies, mothers, whole communities, and a healthier, happier world for all of us.